Good morning, I'm Hanaki Tolentino from DSN 3F, and today I am going to demonstrate the bag technique. So the bag technique is a tool by which the nurse during her visit will enable her to perform nursing procedure with ease and deftness to save time and effort with the end view of rendering effective nursing care to clients. So the public health bag is an essential and indispensable equipment of a public health nurse which she has to carry along during her visits. So the public health bag contains basic medications and articles which are necessary for giving care. Upon arriving at our patient's home, we are going to look for a table or any flat surface where we can place our bag. But before that, we are going to put a paper lining and a plastic lining to avoid the bag from getting contaminated. So first is the plastic lining. The clean part must be up and the folder part touching the table. Same with the paper lining. So after putting the plastic and paper lining, we can now put our bag. And after placing our bag on the table, we are now going to ask for a sink and water for us to wash our hands. And if it's not available, then we can ask for a basin of water. Now we are going to open our bag and we're gonna get the soap and the towel to wipe our hands. This is to prepare for hand washing. So hand washing will help us prevent infection from us to our client. So the towel and the soap. Now we're done with hand washing. Now we're going to open our bag again and take out the apron and put it on with the right place. This helps us to protect our uniform from any bodily fluids that we may encounter during the procedure. So let's assume that this is our apron. So now after putting our apron, we're going to put out all the necessary articles that we will be needing for the specific care to have them readily accessible. For instance, we are going to do the wound dressing. So we will be needing the sterile gauze, cotton balls, forceps, bandage scissor, and the micropore tape. So after that, we're going to close our bag and place it in one corner within our working area. This is to avoid our bag from getting contaminated. Now we're done. We're going to proceed with the procedure. After providing nursing care to our patient, we're going to clean all the things that were used during the process. This is to prevent cross-contamination. So we're going to wipe everything or use a solution to clean it. So after cleaning all the equipments, we have to perform hand washing to prevent transmission of different type of bacteria or microorganisms. After washing our hands, we're going to open our bag and return all the things that were used in the proper places. So we are going to open our bag, and then we will remove our apron, folding it away in our body, the soiled side in and the clean side out. Then we are going to place it inside the bag. Now we are going to take our bag and fold the paper and plastic lining and also put it back in our bag. So the clean part must be out and the folder part must be in. Same with the plastic lining. After putting the things back in our bag, now we will discard all the materials that were used and we will put it in the proper bin. Now we are going to record our findings and the procedure of care that was done, and also we will ask our patient when we can do a second visit. Now I am going to show you the contents of our CHN bag. First is the plastic and paper lining, the apron. We also have the hand towel and the soap. We also have here the pen light, thermometer, 2 pairs of scissors, the surgical and bandage scissors, 2 forceps, and also we have here the disposable syringes, which is the 5cc, 3cc, and 1cc. We also have the hypodermic needles, 19, 22, 23, and 25 gauge. And also sterile gauze pad, and cotton balls, cord clamp, micropore plaster, tape measure, 1 pair of sterile gloves, and also we have the baby scale or portable scale, 2 test tubes, and also we have solutions, which is the betadine, 70% alcohol, hydrogen peroxide, spirit of ammonia, which is used to a fainted person to recover, and also the ophthalmic ointment, and our CHN bag.